I've been asked to talk about topical vaccine questions to NaTHNaC. To NaTHNaC, the National Travel Health Network and Centre. So what I plan to do is give a brief overview about UK travelling patterns, because that will give some context, give you a bit of an overview of the NaTHNaC advice line, and then focus on a few questions, topical queries that we get. I am going to try to make this interactive if the technology allows me to, so I will expect you to get your mobile phones out to do some voting further on. So just a bit about NaTHNaC. We were created about 15 years ago by the Department of Health with the broad goal of protecting the health of the British traveller, predominantly focused on England, Wales and Northern Ireland. And this is what we are meant to be doing. So main thing is developing national guidance, surveillance of health risks abroad that will impact on UK travellers. We administer yellow fever centres in England, Wales and Northern Ireland. And we have a website, which I will show you very briefly, and we have a telephone advice line that some of you may be familiar with, which is open daily and takes a number of travel-related queries from health professionals, which is what I'm going to talk about later on. And this is the team at NaTHNaC. So our websites, we have two websites, one which is Travel Health Pro, which is the general travel one, and we have a specific website on yellow fever for individuals that are working yellow fever centres. So I'd like to get you to get your mobile phones out if you could, and go to menti.com. And enter the code 336663. I'm hoping this is going to work, and answer this question. So which country outside of the British Isles do you think is the most popular holiday destination for UK residents? Right, so we've got a few people putting in some suggestions. And the bigger the word, the more popular it is. So Spain, France, the States, India, and someone's put the UK, although I was looking for destinations outside of the UK. Okay, I'll move on because I know that we are short of time. I will give you the answer to that shortly. Okay, so this is just to give you an overview of UK travelling patterns. The Brits are a nation of travellers, so as you can see here, year on year, the number of travellers, UK residents travelling abroad, has been increasing until around 2006, 2007, with the economic crisis. It went down. But it's increased again, and last year we had the highest number of travellers we've ever had. We had 72 million visits of UK residents visiting, making trips abroad last year. And to give you some context, that's the same as US travellers. So the US travellers travel as much as we do. The interesting thing is that this line here, which represents people who are visiting friends and relatives, actually that number has always continued to increase and represents about a third of UK residents visiting abroad. And you're all interested in which was the most popular destination. So this is UK traveller patterns, and as you can see, actually Spain and France are pretty much the most popular destinations for UK residents. But USA's in there, India's in there as well. But really the top 10 are going to be in Europe or North America. And then when you look at VFRs, people who are visiting friends and relatives, that changes slightly, with other countries like India predominating in China as well. And that's quite relevant in terms of the types of queries we get. So the other thing that we understand from the travel industry is the number of people taking foreign holidays is increasing. And actually the people that are travelling much more than they used to are the older age group. Kitty mentioned this. They have much more disposable income and they are travelling much more. Because the pound isn't as strong as it used to be, people are looking to travel further afield as well. So places in Africa and Asia are becoming much more common. People want to do things that are different, so they want to have more authentic experiences, live much more closely with local populations, and go off the beaten track. And the other thing that we get a lot of calls around is cruise holidays, which seem to be increasing year on year. And again, in the age group that you're looking at is the over 65s. And then you've got millennials, and actually that should be Generation Z, it's not Generation X. They want to do things that are unusual, and they want to take pictures of themselves doing it as well, which actually brings some additional challenges as well. And this is just to tell you that we don't have a one-size-fits-all. What an older traveller might be doing will be very different to this millennial, I think he's probably is Generation Z, traveller. So what are the challenges? We have changing disease patterns in over 220 countries. Preventive and therapeutic interventions or guidance change quite regularly. People are online and booking things online, so we don't really have a good idea of what people are doing. But they also do their own research and may actually look at incorrect information. And Brits like to travel, and they're going to more exotic places. They're researching things more widely, but they're older. You have much younger people travelling as well. They often have comorbidities, and they are often have other things like immunosuppression as well. So moving on to the NaTHNaC telephone advice line, it's run by our very excellent team of nurses. Doctors get the queries escalated to us very rarely. The nurse team actually deal with most of the queries that come their way. We've been able to analyse our data for the last real time for the last 3 years, and we take about 6,000 calls a year from health professionals with complex queries relating to travellers. So since 2016, we've taken about 17,000 calls relating to just under 19,000 travellers. Most frequently queried countries, India, Kenya and Pakistan, and then going back to our travelling patterns, that might give you an idea of why that is. But the types of queries we get are related to people that are either very young, very old, pregnant, have comorbidities, or are visiting friends and relatives. Malaria is the most queried disease, but yellow fever comes quite close afterwards. 2/3 of our queries are related to vaccines, and of those, many of those are related to actually, does someone need a particular vaccine for a particular country, and that information should be available on our website. But about 1 in 5, just under 1 in 5 queries are related to individuals with special health needs, the chronic diseases, the older traveller or the younger traveller. Very few are related to vaccine schedule, and actually almost 1 in 10 are related to certification, vaccine certification, mostly around yellow fever, but a few others which I will talk about. So this is just really an overview of the type of queries that are commonly come to our website, to our advice line. Yellow fever, measles, polio, rabies, the traveller that has special risks, and countries that are popularly visited. And particularly cruises and VFR travel, it comes our way quite a bit. So I want to go back to thementi.com, and I want you to think about what are the contraindications if you could enter to yellow fever vaccine. I'm going to go down again. So we're just going to look at what your entries are. So hopefully people will, no one's voted. Have you been able to, has anyone answered that question? Okay, there we go. Headaches, a contraindication. Age, immunosuppression, allergy to ingredients. So think immunosuppression with various spellings. Age, egg allergy. Right, so we've got a good list of things that you need to think about. So going back to I'm sorry about the toing and froing. Going back to my presentation. What are the contraindications to yellow fever vaccine? So the contraindications actually are the following. So obviously anyone that's had an anaphylactic reaction to any component of the vaccine, particularly egg allergy, is something we're concerned about. Those that are aged less than 6 months, so babies under the age of 6. Those that have a thymus dysfunction or have had a thymectomy for a thymus disorder, and immune compromise. And actually the other things that had been mentioned on that list are cautions. We are cautious about children between the age of 6 to 9 months. Asymptomatic HIV-infected individuals can be vaccinated, but again, we're cautious. The vaccine can be given to pregnant women. It is a live vaccine, but there is evidence that it is okay to give. And actually, age is a caution, not a contraindication, which I will explain about a bit later. So this is a common scenario that we get. This is an older couple, Richard, who's going on a cruise. He's got a few health issues from Brazil to Dakar. So cruises are getting much more exotic as well, and he's going with his wife, and neither of them travelled outside of Europe. So the first thing that you have to do in this is assess, actually get an understanding of the itinerary. I don't know how clear that is to you, but actually they start off in Brazil, here, And there's a few places that they stay in Brazil, and then they go off to West Africa on their cruise, and then from West Africa they'll go back to their home base. And what's very interesting is they're staying in cities, and mostly in Brazil or in towns, but actually in Senegal, they're going to be doing a 3-day expedition into the jungle to look at the flora and fauna there. So that actually just changes your idea of what that risk might be for that couple. So what about the risk of yellow fever and the epidemiology of yellow fever? These are maps from the CDC, and actually there's a risk of yellow fever both in Southern America and in West Africa. And actually Brazil has had an extended risk areas identified in 2017. So most of Brazil, there's a recommendation for vaccine, but the area was extended at the end of last year, middle of last year, due to an outbreak of yellow fever in those areas. And of course, in Senegal, there is a risk of yellow fever and vaccination is recommended. And if you go onto our websites, you can see, and NaTHNaC website, you can see that there is a recommendation for vaccination against yellow fever for Brazil, but also there's a certificate requirement, a yellow fever certificate requirement to enter into Senegal if you are travelling there. But of course, we are concerned about adverse effects associated with the yellow fever vaccine, which I will talk about briefly. But there's a very good paper by Lindsay et al., which looked at vaccine adverse events reported to the US CDC, ACIP rather, over a 7-year period, and they analysed what they thought the risk ratio of certain adverse events were. And NaTHNaC has a fact sheet about adverse events on their website. But of course, when they looked at their data, they found that actually the rate for anaphylaxis was quite low with yellow fever vaccine, 1.4 per 100,000 doses administered, and principally in people who had an egg allergy. But there were two other things they were concerned about. One is something called yellow fever-associated neurological disease, or YELAND. This was something that they found only tended to occur in primary vaccinees. It's the neurological symptoms that occur between 2 to 56 days after the vaccination, and the 3 syndromes that are most commonly reported are mentioned there. Most people recover from that, but actually the risk ratio is thought to be 0.8 cases in 100,000 doses given, but that risk increased in individuals over the age of 60 to 2.2 per 100,000 doses of vaccine given. So of course in our couple, this is something that actually is an increased risk for them, and they haven't had the vaccine before. This is the more worrying side effect of yellow fever vaccine, something called viscerotropic disease. Most of the cases that have been reported are in primary vaccinees, and it effectively is very similar to the yellow fever disease. It occurs generally between 1 to 18 days after vaccination, and case fatality is extremely high at 46%. When you look at risk ratios, so 0.3 cases per 100,000 doses given generally, but 1.2 cases per 100,000 doses given when the person is aged over 60, and the rate increases with age. And there are some other areas that we need to look at, because there are certain risks associated with we have some caution around mothers that are breastfeeding, because there have been some case reports of yellow fevers associated neurotropic disease in very young babies who are breastfeeding and the mother's been vaccinated. In pregnancy, there is a hypothetical risk, but we do, where the risk of the disease is great, we do suggest vaccination. And I mentioned the thymus disorder is a contraindication. When they looked at the viscerotropic cases, they found that 4 out of the 23 cases of viscerotropic disease they looked at actually had thymectomies for a diseased thymus. And 1 case was found to have had a diseased thymus post-mortem as well. So what does that mean for our traveller? Well, we need to know what the risk of yellow fever is in this group. And actually the data isn't very good. We don't really have very good data on travelling patterns, but we don't also have good data on actually disease risk, because people have been vaccinated. But the US CDC did some modelling looking at local illness rates as well, and immunity in local populations and vector densities in various areas. And they estimated the risk of getting yellow fever was 50 per 100,000 if you were going to West Africa, and the risk of death associated with yellow fever was 10 per 100,000, and South America was slightly tenfold lower. But they said that the risk of illness would be greater if there was an outbreak occurring at that time. But these are estimates. We really don't actually know what the true risk is. If you look at traveller cases, between 1970 and 2015, there were only 11 cases reported, yellow fever cases reported in US and European travellers. So it seems very low, but of course, these people have generally been vaccinated. But what was very interesting was in 2016 to 2017, the number of cases confirmed in travellers suddenly increased. There were 11 workers infected in Angola. That, we think, was a failure of certification, using certification as a means of entry. People weren't being very strict about allowing people in without vaccination. 3 travellers to Peru and 1 traveller each to Suriname and Bolivia. So all of a sudden we had as many cases as we'd had over almost a 35-year period. And then last year we had this situation in Brazil, which many of you will be familiar with. There was an outbreak of yellow fever in Brazil, which resulted in cases being reported in areas which previously hadn't had yellow fever, and that resulted in an extension of the vaccination recommendations. And the cases were 920 confirmed cases with 300 deaths. And what was really interesting is because these areas hadn't previously had vaccine recommendations, we were starting to see traveller cases. And I think to date about 11 traveller cases, European traveller cases, have been reported from this outbreak in Brazil, including a traveller who was treated in the UK, but he was actually a German national and unfortunately died. So this makes it quite a challenge. How do you advise this elderly couple who are potentially at risk, particularly for the Senegal bit of their trip, but maybe for the Brazilian bit? But of course, there's a higher risk of adverse events in that group. So if you do choose, I mean, this goes back to the risk assessment and really ascertaining what that individual is doing, but if you choose not to vaccinate them, because there is a vaccine certificate requirement, you will need to give them a medical letter of exemption against yellow fever to allow them to enter Senegal. So moving on to just continuing on the yellow fever theme, we now have a case of a freelance cameraman who's 48 years old, who's travelling to Uganda for a month to film a wildlife documentary about mountain gorillas. He had the yellow fever vaccine 12 years ago, was diagnosed with HIV 5 years ago. He's actually well, has a suppressed viral load and has a reasonable CD4 count. So with this particular traveller, what would you, I want you to, sorry, I've moved ahead of myself. Is that, yeah, so I won't use the voting system because I think it's going to take too much time, but just put your hands up if you would vaccinate this traveller. Would you vaccinate this traveller? Yes? Who wouldn't vaccinate him? Okay, and who doesn't know? Okay, so Uganda does have a risk of yellow fever, but there's also a yellow fever certificate requirement. We know from that map that we saw that there was a recommendation for vaccination in that, and that just shows you that Uganda is actually somewhere here, and it is in that yellow zone. He's going to do something that actually does put him at increased risk potentially, but in 2013, WHO produced some guidance saying that actually 1 dose of yellow fever vaccine should provide lifelong immunity in healthy adults. They did have some caveats and there were some challenges in the evidence that they provided. So this was looked at by the travel subcommittee of JCVI, and actually we felt that for most healthy adults, you could assume that 1 dose of yellow fever was enough to protect them lifelong, but there's certain groups of travellers that you might want to revaccinate. And actually, I don't know if it's very clear, this is in the Green Book, but it lists HIV as one of those groups, people who were vaccinated when they had HIV. So this might be someone that you revaccinate, and in terms of cautions, it is a caution, but actually he can be vaccinated against yellow fever. And because he's been vaccinated before, the chance of him having one of the serious adverse effects is actually quite low. So you might want to vaccinate this person if you think their risk of disease is very high. And of course, if you choose not to vaccinate him, if he's got his certificate, that should be fine. But if he hasn't got a certificate, you might need to produce one for him, a letter of exemption for him. Certificate issues are very common at the NaTHNaC advice line as well, and this is for public health reasons. So countries will sometimes have no certificate requirement to enter a country in relation to yellow fever. Sometimes they will insist that people have evidence that they are immune to yellow fever before they're allowed in, because they may have the mosquito that causes yellow fever present but not the disease, and they don't want to import cases and result in local outbreaks. And some countries actually have exit requirements as well, that they might require you to be vaccinated when you leave, particularly if there's an outbreak going on at the time. And particularly in Brazil, a lot of the Latin American countries had exit requirements at the time the outbreak was going on. And this is all governed by the international health regulations. And in 2016, the international health regulations were amended. Previously, your certificate for vaccination against yellow fever was only valid for 10 years. But in 2016, because of the lifelong immunity, the IHR was amended to state that actually a vaccination certificate was valid lifelong. What they did say at the time, though, was that you didn't need to change. If someone had a vaccination certificate that said it was valid for 10 years, you didn't need to change it. You just kept it as it was. But new vaccine certificates should indicate that the certificate was valid lifelong. And that created a number of challenges because we got an increased number of calls around certificate requirements. Should the certificates be altered? Are we really sure the evidence is there that people are protected? Some people reported that people were travelling across borders and being told that actually they didn't agree with the certificate that was provided to them. And we did have some people that were forcibly vaccinated, particularly when they were travelling across land borders rather than through airports. So we have got guidance on what to do around certification, but really new certificates should actually say the person is vaccinated, is protected for the life of the person vaccinated. But old certificates are very valid, but unfortunately, if you amend a certificate, so some very helpful GP decided to amend this certificate, that will actually probably be questioned at a border, and this just happens to be my yellow fever certificate. The other thing we do have evidence around is unpredictable ICVP checks, so this is certificate checks. So we do know some countries, the border officials do insist on you having a certificate even though it's not required by international health regulations. And Tanzania seems to be quite notorious. There is very low or no risk of yellow fever in Tanzania, but they do have a certificate requirement if you're coming from a country that has yellow fever. But if you're travelling from the UK or a country that doesn't have yellow fever, you shouldn't need a certificate. But we have had anecdotal reports of people being asked to produce vaccination certificates, and that's a real challenge. And then sometimes when there are outbreaks going on, like there was an outbreak in that Angola outbreak, Rwanda suddenly decided to introduce some certificate requirements at very short notice. So moving on from yellow fever, I'll be very quick with this. This mother is attending your clinic with a 6-month-old baby boy, and they're going to visit friends and relatives just outside of Port Louis in Mauritius. They'll be staying for 2 months, and the child is up to date with age-appropriate childhood vaccines. What additional vaccines might, just shout out, I won't go to what additional vaccines might you offer this child? None. 2 months, we wouldn't offer BCG. Any other thoughts? So Mauritius is here. We always say that Mauritius, you need to make sure you're up to date with any travel, make sure you're up to date with age-appropriate vaccines. But actually, we also suggest, and the Green Book says this, that actually you might want to vaccinate a child above the age of 6 months against measles if they're going to a country where the measles might be endemic or there's an outbreak going on. And if you look at the NaTHNaC website, you'll see that there is an outbreak of measles in Mauritius at the moment. So we would vaccinate that child against measles or MMR. So moving on, this is another case, a VFR case, a lady going to a mass gathering. She's going to perform the Umrah, and then afterwards she's going to go with her family to Karachi in Pakistan and stay there for 6 weeks. She's got rheumatoid arthritis and is on methotrexate. So a question to you is, what vaccine certificates does she need for this trip? Just shout out. Meningitis, yeah. Any others? Yeah. So meningitis is required for the Hajj because and the Umrah, so that's a requirement by the Saudi government. It's not an international health requirement, but some of the more astute of you notice that actually there's a requirement for polio vaccination, evidence of being vaccinated against polio if you're travelling to Pakistan and staying for a long period of time. We're close to polio eradication, and this isn't about a risk to the individual, this is about trying to prevent further spread of the disease. So, but the WHO amended their international health regulations and made it a recommendation for states to make sure that people are vaccinated when they leave certain countries where there is endemic polio. And this is just an example of a certificate that you might produce for polio. The other consideration in this woman, though, is that we've started having reports of extensively drug-resistant typhoid in Pakistan. Karachi is one of the areas where this has been reported in. And of course, whereas we know that the injectable typhoid vaccine may not be as effective as some other vaccines, actually this is where it makes it much more important to emphasise the need for vaccination, particularly in VFR populations. We know that VFR populations going to South Asia are at increased risk of enteric fevers and typhoid, so that's something else to consider. And of course, I won't go into it in much detail, but the VFR population are a group that we are worried about because they tend not to get pre-travel advice. They tend to live more closely with local populations and actually are perhaps more exposed to certain infectious diseases. So we need to be a bit more aware of them as a group. And then just very briefly to mention the fact there was a very sad case of an individual dying of rabies at the end of last year, and this was a VFR who was visiting friends and relatives and was bitten by a cat. I won't, for interest of time, just to highlight chronic disease a real concern, and I guess the challenge is that people with chronic diseases now are able to travel. They tend to have more opportunities to travel, and I guess if you're working in primary care, it's always worthwhile asking if they have got any plans to travel so that you can actually opportunistically give them advice, because what we found again is this is another group that don't tend to get pre-travel advice or don't get very good pre-travel advice when they travel. So in conclusion, I think most of our queries do relate to yellow fever and those special risk groups that I just mentioned, or combination of those, and advising on risk can sometimes be a real challenge. Particularly with the VFR group, they don't often access pre-travel advice and they tend to listen to what their friends and relatives tell them locally. And I guess going back to what Joe was saying earlier, that actually there are really good opportunities in primary care to make every contact count. So if you have got a VFR family, it might be worth asking, are you planning to have travel anywhere in the next year or so, to actually try and provide that proactive pre-travel advice. And then really, if you're in doubt, not sure about what to do, you can always phone our advice line. The number's up there. We deal with all sorts of travel-related queries, so please feel free to call us, and thank you for your time.